We're getting closer to retirement. That's a big thing on my mind. And I'm one of these people that when we retire, we're not sitting in a rocking chair watching the grass grow. It's one of the reasons I moved to Vegas. Going to own a lawnmower, first time in my life, okay? So, but we're going to go places, you know, and you need your health. I had a pinched nerve in my neck, and I woke up one day, and I'm left-handed, and this hand was semi-paralyzed, and basically that's about all I could do was right there.
So my husband started experiencing some pain in his neck, and it just was keeping him awake at night. And so we finally, I insisted that we go to urgent care. And so when we went to urgent care and they did an x-ray, when they were in the process of x-raying him, he said he felt the worst pain he's ever felt in his life. And I said, honey, we're there. They're going to give you a shot. You're going to feel better. He didn't feel better. He felt worse. And he woke up the next day paralyzed. And, you know, being left-handed, and I just thought, you know, how is he going to even function? And, you know, I had hopes that, you know, it was going to, as the inflammation went down, that, you know, it was going to improve. And, you know, I kept trying to be strong for him and saying, honey, you know, this is just temporary. It's going to get better. But, you know, when you can't even open your hand and you're thinking, God, you know, I don't want to get emotional, but you're thinking, this is it. You know, now he has to go through this for his whole life. And I know people go through far worse, but when you love someone, you don't want to see them suffer. And then for us to come here, and for him to get the relief and start seeing his fingers move again, and him being able to, you know, even pick up a hammer or a screwdriver and do something around the house, because he's always been very handy. It's just, I realized that, you know, it's getting better. It's, you know, it's not an overnight fix, but it's getting better. Yeah.
But it's getting better. But I also have, the reason for that happening is I have bone spurs and degenerative disc disease. And since I've been coming here, this has been getting better. I'm able to use it more. I've got more feeling in it. And what I didn't realize, and it was really funny, I didn't realize it today because I was reading a little pamphlet that I've never read before. My blood pressure has gone down considerably. I'm a type 2 diabetic and I take medications, and my blood pressure is lower than it's been in years, to the point that they're probably going to wean me down off of this. Didn't even think about that. I read it, and that is one of the things that can happen.
Okay, come on off there. Have a seat on the table. Okay, take a nap. See how good he is at that?
It's easy.
That's easy. Okay, go ahead and sit up for me. That's your special spot, isn't it?
Find it. Oh my gosh, you found it.
Okay, let's see that paw. Let it relax, relax. Good.
So, Doctor, I was reading your pamphlet for the first time, and I saw never really paid attention to about the blood pressure.
Yes.
I was telling him I've had 3 doctor's visits just because of some other stuff. My blood pressure is running below what it's been in years.
Wow.
I didn't even think about
that's
that
great.
It was this, but I know.
Can be connected. Let's double check you. Come on up again.
Yeah.
That's sweet.
Yeah. Something exciting for me.
Okay, come on off.